Hi, my name's Dr. Steve Walsh, and I'm an optometrist, and I'm here to talk to you today a little bit about eye health and kind of go through an eye exam a little bit with you all as well. So first of all, I like to talk about what's the difference between an optometrist, an optician, and an ophthalmologist. So an optician is a person who makes and sells glasses. They're really experts on the lens designs of glasses and frames. And so we have opticians here at our office. We kind of talk about them as our stylists for our patients. They try to find frames that look good on people, and we also give them lenses that work well for their different things that they have to do with their eyes. An optometrist, which is what I am, we're kind of like your primary care doctor for your eyes. So we can treat eye disease like glaucoma and eye infections. We get prescriptions for glasses. We can fit contact lenses. We do a lot of the general eye health and vision things that most people need. An ophthalmologist is an eye surgeon. So if you need surgery on your eyes for cataracts or other problems like on the back of the eye, then that's where the ophthalmologist would work on you. So that's kind of the different jobs of the different people who work with eyes. One of the things I like to do a little bit to get things started is talk a little bit about the parts of the eye and make sure that everyone's kind of familiar with that. So this isn't very high tech, but it works. This is the eye cut in half. This is the front part and this is the back. This front part is called the cornea. It's a clear covering of the front surface of the eye, and light passes through that. That's what a contact lens would sit on, or if you get a scratch on your eye, that's the part that can get scratched. These two things here, that's a side view of the colored part of the eye, that's called the iris, and that opens and closes depending upon the lighting. So if the light's bright, that closes down smaller, and the little space here is the pupil. If the light is dim, that gets more open, the iris retracts, and the pupil gets larger, and that lets more light into the eye. This is the crystalline lens. And this lens is responsible for your near focusing ability. So when you look from far away to up close, these muscles pull on this lens and make it flex, and that pulls your focus point from across the room to up close. As people get older, into their 40s and 50s, this lens starts to get stiff, and that's where you start to maybe notice your parents or your grandparents with holding things far away or they can't see up close. That's because that lens has gotten stiff as a normal age-related issue. That lens also over time becomes cloudy, and that's called a cataract. And you may know someone who's had cataract surgery, and that's where they take that lens out and they put an implant in. This is the inside of the eye. This back lining here is called the retina. Kind of acts like the film on the camera. That takes the light and transferred it into a neural message that goes down the optic nerve into your brain. So that's how your eye works to allow you to see. Go ahead and stop. So we've moved to our pre-testing room, and I wanted to show you some of the different machines and technology that optometrists would use during an eye exam if you had an eye exam done. One of the reasons I became an optometrist is we have lots of cool toys we get to play with. We do a lot of things with technology, and we don't give shots, and I hate needles, so that kind of made that a really good fit for me. So this first instrument is called a retinal camera. And what it does is it allows us to take a picture of that back neural surface we talked about, the back part of the eye called the retina. So I'm going to take, this is Morgan, I'm going to take a picture of Morgan's eye, and then we'll show you what that looks like. So you go ahead. All right, Morgan, go ahead and put your head in there. Now there's no puffs of air here or anything. You'll just look at that target in there, and this is going to take your picture just like you normally would. So go ahead and blink a few times for me. Open real wide, and okay, go ahead and stop. You can go ahead and sit back. So we've got a picture of the back of Morgan's eye. So this looks like Mars, but this is her. So this white circle here is called the optic nerve. That's where your eye and your brain connect. You can see the blood vessels coming out. And this dark area here is called the macula, and that's where all the cone cells or the color vision cells are all tightly packed together. So the back of the eye can tell us a lot about your eye health, and that's why we take pictures to look for changes that can be associated with high blood pressure, diabetes. If you have high cholesterol, you'll get low cholesterol plaques in the vessels. If you've got a heart valve problem, you'll get little calcium blockages there. So you can really tell a lot about someone's overall health just by looking at their eyes and their blood vessels. Now we're going to take an in-depth scan, because this just shows us the surface on the next instrument of the optic nerve. So let's go over and do that.
Go ahead.
Now, this instrument is called an OCT, and what it does is it uses light to measure the layers of the back of the eye and gives us a scan that we can look at in 3 dimensions. And so I'm going to take this scan. Again, there's no puffs of air, nothing hurts with this. We're just going to take a picture of Morgan's optic nerve, and then we'll go back into the exam lane and look at that as well. Okay, Morgan, are you ready? Go ahead and blink a few times, and look at that target in the center. Hold still, open your eyes real wide. Okay, good. You got that picture. Go ahead and sit back. Before we go away, this instrument that you probably saw in the background, this is called an autorefractor. And so I know a lot of times if you've been to the eye doctor, you may be familiar with the Better 1 or 2 test where the doctor kind of asks you questions about which lens looks better. This instrument actually automatically can measure that prescription based on the curve of the front part of the eye, the cornea, and the length of the eye. And that gives us the ability to at least start with a prescription so we don't have to ask quite so many questions. This instrument also measures pressures for glaucoma, so it's 2 things in one. But like I said, we have a lot of cool toys we get to play with. So one of the things that you might see when you're at the eye doctor is called a slit lamp or a microscope, and that's this instrument. And it lets the doctor look at the front surface of the eye to look for infections. We can also use lenses to look inside of the eye. And that's oftentimes why the doctor might put dilating drops in your eyes to open up your pupils so they can see inside better. Go ahead and put your chin there for me, Morgan. So again, it's just a light. Morgan loves this instrument. It's her favorite one. And I'm just going to take a good look at the front of her eyes and make sure everything looks nice and healthy. And this one as well. And everything looks nice and healthy. Now, if I want to look inside of her eye, I can just use this lens. Morgan, look here at my ear and have you open your eyes as wide as you can. And this doesn't touch the eye. I'm just looking inside of the eye with this lens. And it lets me look at the back of the eye through the pupil and through the lens at the retina and again at her optic nerve and the blood vessels back there. Good. Everything looks nice and healthy in there. So we've taken a picture of Morgan's optic nerve, which is right here. And if we look at the 3-dimensional scan, which is on this side, it shows us that the optic nerve dips down and the nerve fibers go back to the brain. You can also see the blood vessels here. This instrument also will give us an analysis of, again, it shows where the optic nerve dips down like this and the nerve fibers are going back to the brain. And it also measures the thickness of the nerve fibers to make sure they're healthy. And Morgan's young and nice and healthy, so that blue line is where her nerve fiber thickness is, and the green area is what's a normal layer. So she is in the green, everything looks nice and healthy, so she doesn't show any signs of optic nerve disease, which is typically associated with a disease called glaucoma. Now, let's talk a little bit about some of the other instruments that you might see at the eye doctor. This is a fancy version of the Better 1 or 2, but this instrument is called a refractor. It has all the lenses in it that you could ever need to create a prescription for somebody for glasses or contacts. And you would look through this like a pair of binoculars, and the doctor would use some different lenses to see which power or prescription gives you the best vision. I won't make Morgan sit through that. One of the other things I like to talk a little bit about is contact lenses, because you may have seen advertisements for Hubble on TV or 1-800-CONTACTS where you can get in your online eye exam for contact lenses. Contacts can be pretty dangerous if they're not fit properly and taken care of properly. So some basic things that you should be aware of with contact lenses are, number one, you shouldn't sleep in your contact lenses because your eyes don't get enough oxygen when that happens, and it really increases your risk of developing a vision-threatening eye infection. Number two, you should never put your contacts in your mouth. There are bacteria in your mouth that if they get in your eye and you get a scratch, that bacteria can actually eat through the front part of the eye in less than 24 hours and create really serious eye infections. Number three, you should replace your contact lenses as directed. So I know sometimes if your doctor says you can wear a lens for a month, you might wear it for 5 or 6 weeks. In doing so and stretching it out, you're also creating some health problems with your eyes that can cause some long-term damage and potentially even blindness. Most of our patients are in a daily lens that they just wear for the day and they throw away, so we don't have to worry about those kind of risks and problems that are oftentimes associated with contacts that you keep for long periods of time. When should you go to the eye doctor? So we typically talk about going to the eye doctor every year to have your eye health checks done, kind of like going to the dentist every so often to have your teeth checked. So just because you can see well doesn't mean that your eyes are healthy. On the other side of that, just because your vision's blurry, that doesn't mean your eyes are unhealthy. Sometimes it's just prescription that needs to be fixed, but that's not something that you can really tell. And your eyes have so much redundancy that by the time a health problem causes vision issues that are such that you can see them, usually you've got a lot of damage to your eyes that oftentimes we can't fix. So the recommendation is every year, even if you feel like you see okay, to go in and see your eye doctor and have your eye health checks. Kind of think of those as eye physicals. If you have any other questions, please don't hesitate to reach out to your eye doctor. We love to talk about eye care, and we would love to answer any questions that you might have. Thanks for taking some time to learn about eye health with me.